My name is Jennifer Salazar, and I am your state director for the Texas Senior Medicare Patrol. And I also work for the Better Business Bureau Education Foundation in beautiful Houston, Texas. And a lot of people ask me, well, Jen, how can you work for the Senior Medicare Patrol and you also work for the Better Business Bureau? Well, that's because the Better Business Bureau in Houston has the federal grant for the Texas Senior Medicare Patrol. And Senior Medicare Patrols are in every state in the United States, including Guam, Puerto Rico, the Virgin Islands, and Washington, D.C. We are federally funded through the ACL, which is the Administration for Community Living. And what we do is we recruit and train volunteers and professionals and train them about Medicare fraud, error, and abuse. Now, if real fraud or abuse ever happens, my team and I build the case for the great state of Texas, and we turn that over to the Medicare control units, like the FBI, the Office of Inspector General, the Attorney General's office, and the list goes on and on and on. We don't investigate the cases, we build them and we turn them in. So the history of the Senior Medicare Patrol started in actually 1995, so it's still a new program when you think about it. We were actually born in 1997. The way that this all happened is in 1995, so much Medicare fraud was happening, and it was actually senators that proposed the idea of the Senior Medicare Patrol. And in 2003, we went nationwide, and as of today, we have 54 in the state, in the whole United States. Now, we've had the grant since 2008, and we were just renewed another 5 years. So we're very honored to serve our fellow Texans. Our program here, and I have some lovely pictures of some of my greatest volunteers. We have a volunteer program, and I'm the trainer for our volunteers because I want to make sure that they get the best training we could possibly provide them. And I believe it starts at the very top with me, and then we assign them to a coordinator and someone to also help them with their outreach. And what our volunteers do is they do speeches, they staff health fair booths, and they get the word out on what we do to stop Medicare fraud, error, and abuse. Now, during coronavirus, we're really not doing that many presentations. We're doing it virtual, like I'm doing for you all today, because our safety of our staff, our volunteers, and the community always comes first. And we even have a special hotline. It's toll-free. Our government grant does pay for that, and that's for you to report Medicare fraud, error, and abuse. We have a special mission statement. It's to empower and assist Medicare beneficiaries, their families, and caregivers to protect, detect, and report healthcare fraud, errors, and abuse through outreach and counseling. And over here, these are not real scammers. These are two of our lovely volunteers, and they're actually holding up what we call durable medical equipment, which we'll talk about in a little bit. Did you know that Maura, she's the lovely lady in the white blouse, she has on right now a hand brace. Did you know that that costs the Medicare program $892, but it's only worth about $30? That's right. Wow. That came from a scammer. I know. Isn't that shocking? Yes. And Judy in the pink blouse, she is holding up a back brace. Now, this back brace was Medicare was charged over $500, and it's worth maybe $25 at Walmart. And we're going to get into that scam in just a little bit. Now, our program is accountable to the federal government, the ACL, which is the United States Administration for Community Living, and the Office of Inspector General. So those are our bosses. We're not governmental employees, but we do have a governmental grant. And also the taxpayers, you pay for this program. And we thank you for that because we want to stop Medicare fraud before it happens. Now, I like to go over the very basics of Medicare before we jump into the scams. And then I'll talk about the scams that we see the most in our state. Now, I will warn you, not every scam is on our list because we'd be here for days. I promise you that. So we're going to go over the most scams that we see. But the very basics of Medicare. In 1965, President Lyndon B. Johnson signed Medicare into legislation. This was a huge day for history. It was the first time in history that the government was going to help provide health care to our greatest generations and generations after them. This was huge. And back in 1965, those were the days that a computer took up a room in NASA, right? Fast forward to today. We now have phones that we can look at, and we can read text messages. We can get on the computer on our phone. We can access the internet on our phone. Well, did you know back in 1965, fast forward to 2020, we still have one major thing in common. When Lyndon B. Johnson signed Medicare into legislation, he also signed that Medicare will never call you on the phone. It's a fraud protection. Medicare will never, ever call you on the phone, and that is still in existence today. That's a huge fraud protection that he established back in 1965 that is still holds true today. Now, let's talk a little bit about Medicare. To get Medicare, you must be a United States citizen or be a permanent resident that has lived in the United States for at least 5 years continuously, or be 65 or older, or be 65 and be under the age of 65, but older than 18. Basically, this is if you have a disability. You can apply for Medicare if you have a disability. You would get Social Security disability insurance for 2 years before your Medicare will start. Now, the only way to get Medicare over the age of 18, but under the age of 65, is immediately would be Lou Gehrig's disease or end-stage renal failure. Now, there's so many parts of Medicare, and don't worry, you don't have to memorize all this. I'm kind of setting this up for my presentation. So you have Medicare A, which is your hospital coverage. Then you have Medicare Part B, which is your medical. Usually these services pay 80% of your service, okay, unless it's preventative. It's 100%. Now, if you need help paying what's left over of that 80%, if you need help with 20%, you can purchase what's called a Medigap, which is a Medicare supplemental plan. Then you have something called a Medicare C. This is a Medicare Advantage plan. It replaces your original Medicare. Instead of having Medicare A and B, you now have a Medicare Advantage plan. Then you have something called Medicare's prescription drug plan, known as Part D. Now, you can have Medicare A, B, and D, but you can't have Medicare C and D. Oh my gosh, I don't know about you, but isn't that complicated? It can get very complicated very quickly. And scammers know that. Scammers know that. Did you know when I moved from Beaumont, Texas to Houston, Texas, I had in 1 week 21 different interviews because I was a trained benefits counselor. I worked for an area agency on aging, and I was also a nursing home ombudsman. I'd go in the nursing homes to advocate for the people in the bed, made sure that they were treated correctly, but I'd also help people with their Medicare, understanding their Medicare. 21 job interviews, and all but 2 were scammers because they look for people that know about Medicare because they think that you will help them scam. It's very sad. Because a lot of people, it is sad. And again, a lot has changed from 65 to 2020. And why is Medicare such an easy target? It's very sad, but in one business day, Medicare processed 5.6 million claims. 5.6 million claims. And only 3% of those claims are reviewed by Medicare because Medicare wants you to review something called your Medicare summary notice. And if you review that, you can catch error, fraud, and abuse. But, my friends, the reason my program exists, the Senior Medicare Patrol, is not everybody knows how to read a summary notice. Some people don't even know what a summary notice is. That is when you're on Medicare and you get mailed a paper every quarter and it tells you what you spent with Medicare. I have clients that have Alzheimer's, dementia, in a nursing home, or like my husband, don't worry, he's not 65 or on Medicare, but he doesn't read the mail. So some people just don't read their mail, or they don't know what to look for, and that's why we're there. We're there to help. So scammers target Medicare. Did you know a Medicare number is worth at least $30,000, but not to you, to a scammer? The smallest case I have ever built was $18. My biggest case I have ever built was $250,000, which I'll tell you more about that in a little bit. All right. So there are 3 areas of Medicare fraud, error, and abuse. It's error, abuse, and fraud. And let me tell you a lot of ways these people get your information. Because do you guys ever wonder, how in the world do scammers find me? Why do I get all these phone calls? Usually it starts with a robocall or just somebody calling you. And scammers have a technology called spoofing. They can change the phone number in your caller ID box to any phone number they want. And a lot of times they like to use your area code in the first 3 digits of your phone number because you might pick it up. Well, guess what? If you pick it up and say hello, they may hang up on you or they might talk to you. But once they know that phone number is real, because scammers are either using a dialer, it's a computer that puts phone numbers together, or they're either typing in numbers into a phone. But once they verify you're real, they go to the internet. They research your number. Sometimes they get lucky and they'll find your name, your address, and then they'll find out, oh, she's over the age of 65. I bet she's on Medicare. And then they'll call you trying to get your Medicare number. Does that sound familiar?
Not to me.
All right. Oh, that's good. I'm glad.
Yeah, me too.
But now you know what to look out for.
Right.
So let's go over Medicare fraud and abuse. Fraud and abuse is so close together. And there's one word that separates fraud and abuse. It's intent. The main difference between Medicare fraud and abuse is intent. Was the improper behavior intentional and conducted knowingly? Only investigators from like the FBI, the Office of Inspector General, the Texas Attorney General, the only ones that can say yes or no if it was intentional, if it was fraud or abuse. If I get a possible fraud or abuse case, I can say this is possible abuse or fraud. I can't say this is definitely fraud because I'm not an investigator. Again, my job is to build it and send it. That's what I do. Now, let's break down fraud just a little more. This is basically an intentional deception or misrepresentation that could result in an unauthorized benefit. Now, abuse, this is basically more happening accidentally. Its incidences or practices inconsistent with sound medical or business procedures. So let's go over the scams in the state of Texas. And this way you know what to look out for. Now, errors, we're going to talk about errors at the very end of the presentation and what to look out for. But a lot of time errors with the Medicare program have to do with like double billings on your Medicare summary notices, a wrong test, or services not provided. A quick little side story. I have a lovely lady, 82 years young, call me because she saw something on her Medicare summary notice that didn't look right. She's 82 years young, and on her Medicare summary notice, she was tested for pregnancy. Now, the good news is she wasn't pregnant, so she didn't make the news. But it was actually a coding error. They accidentally put the wrong code down, and we got that fixed. So accidents do happen whenever you're working with humans and computers. God only knows what can happen. Not only that, there was a lady that called 1-800-Medicare, and she's from the state of Iowa. She saw something wrong on her Medicare summary notice. She was double billed for something. Did you know her one phone call to Medicare saved Medicare $2 million? Because it was a computer error. They accidentally duplicated a lot of people's Medicare summary notice charges. So a simple error can end up huge. It could be a huge cost savings if you catch it. So let's go over the scams that we see the most of in our state of Texas. All right. So first off, scammers read the headlines. And can anybody guess, besides the election, what is the biggest thing on the news right now? And the reason we're all stuck at home and I'm doing this speech virtual.
Yeah.
Coronavirus.
Yeah.
We're seeing a lot of coronavirus scams, and especially with Medicare. Now, what's happening is the scammer is attempting to bill Medicare for fake tests related to the coronavirus or trying to get your Medicare number. They're using anything they can to get that Medicare number. And remember what I said in 65, Lyndon B. Johnson said, Medicare won't call you. Scammers know that you know that now. So they're going to try to trick you into giving you your Medicare number, sorry. So one of their tricks is they're going to call you, and I'm going to pretend to be the scammer, okay? Hi, this is Jennifer, and I want to make sure that you are safe against the coronavirus. Are you on Medicare? Great! We can send you a senior care package. In your care package, you will get hand sanitizer, hand wipes, Lysol, N95 mask, and gloves. All I need is to verify your Medicare number because Medicare will pay for this. Well, guess what? Medicare's not paying for these. This is a big scam going on right now in the United States, but also in Texas. If you get a phone call or somebody coming to your door offering you this free kit, say no. Also, another scam going on. People are calling, offering you free 95 mask, N95 mask. It's a special mask they wear in the hospitals. All you need is your Medicare number. That is a lie. Medicare will not pay for this equipment, period. Now, I do want to go over what Medicare will cover because I always talk about what they won't, but you need to know during coronavirus, you're right, and what Medicare covers. And don't worry, I'm going to send this presentation out to Miss Bethany, and she can get it out to everyone. So that way you'll have it all in front of you. So Medicare will cover your Medicare Part B. Now, if you're on a Medicare Advantage plan, same applies. Your Medicare Part B will cover coronavirus tests when ordered by your doctor on or after February 4th, 2020. Medicare covers all medically necessary hospitalizations, including extra days in the hospital for patients who had to stay longer because of coronavirus. Now, if you are in the hospital and you had to stay extra days and it's denied, give us a phone call. That's an error. We can fix it. There is no vaccine for the coronavirus at this time in America, but if one does become available, Medicare will cover it. Now, if you get a phone call offering you a vaccine or a cure, or if you get an email saying that you will get a cure, it is all scams. Scammers are doing this right now. They're sending emails saying that they can send you a vaccine or they can send you herbal teas that will cure the coronavirus. Those are all scams. Don't click on it, erase them. Now, Medicare also expanded coverage of telehealth services. This is when you don't have to go to your doctor in person. You could do what's called FaceTime or even talk to them over the phone to have your exam. This includes access to your doctors, nurse practitioners, clinical psychologists, and licensed social workers. Medicare doesn't want anybody to get the coronavirus, so they are covering this. But guess what? To every good, there's a bad. There are providers, these are doctors, that are calling patients to check on them, but they're not doing an exam. But then they go charge Medicare. That is fraud. You can't do that. Now, if you have an appointment and your doctor does do the exam, that's okay. But if somebody calls you saying they just want to check on you and bill Medicare, that is definitely a scam. And there are a lot of coronavirus scams we're seeing right now. And we have a special video on YouTube where you can copy and paste this link and you can watch one of our speeches on the different coronavirus scams because there are a lot of them that you need to know about. But today we're going to focus on Medicare fraud. So the one way that most Medicare fraud starts, and this is involved in almost every one of these we talk about, is the phone scam. Now, you should know, like I was just telling you, Medicare will never, ever, ever, ever call you on the telephone. You will get a call from the Queen of England before you get a call from Medicare because it's not going to happen. And what happens is scammers will call you, trying to visit you, trying to get your Medicare number. It's okay to be rude. It's okay to sling them the phone down. Now, 2 years ago for Christmas, I bought my grandmother an air horn. These are very loud horns that we used to use at the football games before coronavirus. If somebody's calling you trying to get your Medicare number, you can be very polite and tell them, just a minute, let me go get it. Then you take the air horn and you blow it in their ear. They won't call you back.
Good idea.
The Medicare, it's entertaining. The Medicare card scam. Last year and 2 years ago, Medicare mailed everybody a brand new Medicare card that took your Social Security number off your card, and it's a fraud protection. But scammers know this because scammers read the news. So these phone calls are still taking place today. They're going to call you on the phone, and they're basically going to say, "Hi, this is Jennifer from Medicare. Did you get your new Medicare card? Wonderful. Was it paper or plastic? It was paper. Well, I apologize on behalf of the federal government. We'd like to mail you one in plastic. I just need to confirm your Medicare number." "Oh, well, if you can't give me your Medicare number, we just need $2.99 in shipping and handling." "Well, if you don't give me any of that, I'm going to cut you off of your Medicare and you'll never be able to go to the doctor or go to the hospital." These people get mean very quickly, my friends, and they become threatening. Know this, they're not going to come to your home. If they know your address, don't be scared because they found it on the internet. Hang up. Medicare's never going to call you. And guess what? It's a pain in the rear, but there's no such thing as a plastic Medicare card or Social Security card. So if you're like my husband, please check your pockets before you put anything in the washing machine, because you can wash these cards and they will ruin. All right. Next is genetic testing. This was very big last year. We're seeing a few cases this year. Out of all 54 senior Medicare patrols in the United States, my team in Houston was number 3 in reporting the scam. That's how many of these that we got. So what is genetic testing? Here's some examples of what we saw and what genetic testing is. It's basically a company that will offer you a free genetic test without your doctor's order, without your doctor's prescription, okay? Now, these tests are real. They really have these tests, but Medicare won't cover them unless your doctor orders them. They will offer you a cancer screening, a DNA screening, even a dementia screening. And basically the company, these people develop these companies, and they're trying to get you to take these tests because they want to bill Medicare. But in reality, they only want your Medicare number. And this is how it works. These companies hire people, and a lot of the people that are hired don't even know that they're part of a scam. And a lot of times these companies will target cancer survivors or seniors, because if they go do presentations and do these tests, you might actually do one with them, because the person will actually say, "I've had cancer. I don't ever want you to have cancer. Please take this test." And the test consists of a cheek swab. The individual will take a cheek swab and ask you for your Medicare number for billing purposes. The representative, that's the person doing your cheek swab, will promise you that Medicare will pay for the test. All you got to do is a cheek swab. They basically swab your cheek, they put it in a solution, they send it off to a lab, and they basically wait, and it'll tell you if you have cancer or not. The representative may offer you money or a gift. Now, it is illegal to accept anything of value, like money, gift cards, groceries, in exchange for Medicare services under Medicare. Now, what we saw a lot of was they would take your cheek swab, they'll ask for your Medicare information, and they'll bill Medicare, and you'll never hear back from them. We put together about 300 of these cases. Only 2 of these people got their test results, and guess what? They were both inconclusive. Now, the representative may not even conduct a genetic test. We saw this with most of our cases. Instead, they take a picture of your Medicare card or your Advantage card, your Medicare Advantage card if you don't have original Medicare, to see if they will pay for the test, if Medicare or your Advantage plan will actually pay for the test. Some labs may offer a cheek swab for genetic testing as part of a free healthcare screening, but they still need your Medicare card. We have a lovely couple from Austin, Texas, that thought they were getting a free health screening. Guess what? They got a bill for $10,000 because Medicare denied payment of their genetic testing. But we fought it, and they didn't have to pay it. We saw a lot of these scams at churches, health fairs, senior housing, senior meal sites, educational sessions, home health care agencies, anywhere older adults would go. We even had a case in the Dallas-Fort Worth area, in a town in that area, where they were set up at a grocery store. These representatives were set up by the Peaches, I kid you not, doing genetic testing. They would go anywhere and everywhere, and they will even come to your home. This is an actual kit. This is one of my cases. One of my clients called me to say, "Miss Jennifer, I got this test and I don't know how to take it." I'm like, "Wait, what?" It turns out He didn't even know it was fraud. This right here is fraud, my friends. They will send it to your home and ask you to do your own genetic test. Now, this is what I want you to know. Medicare will pay for these tests. They will pay for DNA and genetic tests in very rare circumstances, when it's medically necessary for treatment or diagnosis of a medical condition. If you have a history of cancer in your family, and if you have a history of cancer, Medicare will pay for this. But Medicare just won't pay for it for anybody because it's a very expensive test. Medicare requires an order from a treating physician or qualified practitioner and a signed beneficiary consent form before paying for this test. I want you to be aware, if you really need a genetic test, it would be done in your doctor's office, not a health fair. We've seen people line up in lines waiting for their genetic test. Guess what? You don't do that. You go to your doctor's office. Would you have a medical exam at a senior center? No, I wouldn't. People have been stuck with big bills when their insurance plan has denied the test and wouldn't pay for it. Also, I want you to be aware, if the client does not pay the bill, they can be sent to collections. We have some of those cases. If the test or product is truly free, you wouldn't have to give your Medicare number. And never, ever, ever give your Medicare number or your date of birth to anyone for tests not ordered by your doctor. Now, if that didn't scare you, let's get into durable medical equipment. And when I talk about these things, everyone, I'm not trying to scare you. I'm trying to make you aware of the scams. Because did you know AARP said that if you know about a scam, you're 80% less likely to fall for it. So durable medical equipment. This is basically like walkers, wheelchairs, back braces, knee braces, power scooters. And it starts off like this. You'll get a phone call and it'll sound like this. Hi, this is Jennifer from the Pain Management Center. Are you in pain? Does your back hurt? Does your knee hurt? Oh my goodness. Well, let me get you over to Dr. Salazar. And then Dr. Salazar will come on the phone and he'll tell you to do stupid things like, can you touch your toes? Can you reach to the sky? Does it hurt when you move? Well, I want to get you a back brace. Let me get you back over to Jennifer. And they're going to transfer you a few times because they want to make it sound legitimate, but they want to confuse you as well. Then Jennifer will be so sweet, and Jennifer will ask your height, your date of birth, your weight, because they want to make sure that they get the right measurement. And then your Medicare card. Well, guess what? They gotcha. They're asking all these questions because they're trying to get that Medicare card. And the problem is you'll either end up with back braces and knee braces or junk. You might not even get anything in the mail. Mm-hmm. So you need to watch out for suppliers who offer free equipment but bill Medicare. Did you know last year $60 billion was reported in Medicare fraud, error, and abuse? But that's not the real number because that is what was reported. The government actually projects it's $260 billion because not everybody knows to report. Also, Medicare will willingly accept, Medicare beneficiaries who willingly accept unnecessary medical equipment or supplies or allow their Medicare numbers to be used in exchange for money or other things. That's right. We have cases where people will sell their Medicare number or they will get the durable medical equipment and they will sell it. For example, there was a lady in, I hate to say Dallas-Fort Worth again, but that's where it happened. She was getting all this free equipment that people kept sending to her, and she would sell it. That's fraud. That's fraud. She thought it was wrong of them to send it to her, but she thought she would make a profit. Yes, even Medicare beneficiaries, Medicare recipients can be part of the scam. And doctors or suppliers who provide durable medical equipment you never needed or requested and charge Medicare for the items you never received. For example, we had a guy that hates to go to the doctor, and he thought it was a miracle when somebody called him, offered him a knee brace. He did the intake, he gave his Medicare number. Then he called me 8 weeks later yelling at me because he got the phone numbers confused, and he thought I was the supplier, and he basically said that he wants a knee brace. Well, we talked to him, told him what we did, and it turns out that they deducted over $1,000 from his Medicare. And he never got the knee brace, ever. But we got him, he was able to go to the doctor. We were able to get it removed from his Medicare records. But still, go to the doctor. If you really need a knee brace, a wheelchair, anything, go to your doctor's office because you want to make sure you get the right equipment, not junk. Also, oops, my mouse is happy, sorry. Sorry, y'all. Suppliers who want you to use their doctors, this is a huge sign. If you get a phone call and they're pushing you to use their doctors, that's because they don't want your doctor involved, because your doctor might say no to it. And not only that, they can't fraud Medicare if your doctor's involved. Also, companies that bill for duplicate orders. We had a sweet gentleman, one of my clients passed away, unfortunately, and his number was used over and over and over again, his Medicare number. And they kept sending him the same equipment over and over and over again. And it was very sad. And they tried to bill his Medicare once he passed away. That happens a lot. Suppliers will try to bill for people that passed away. Now, Medicare catches most of these. Also, like I've been saying, these scammers will basically give you generic off-the-shelf equipment. It's not good equipment, it's junk, but they bill Medicare thousands of dollars. Home health care, moving on. So home health care is a wonderful thing that you can get with Medicare. If you just recently had surgery or need help on your feet, Medicare will cover for you to get some help in your home. I'm not talking about cleaning your windows, okay? I'm talking about maybe wound care, physical therapy, things of that nature. There are certain things you have to do to get this. You have to be homebound. You need skilled nursing care. You have to have a care plan in place. You have to see your doctor in person, okay? But right now with Corona, they are doing some of those telehealth, so that's a little different with Corona. And the home health care agency must be approved by Medicare, has to be approved. Now, what we see as far as the scams is no services received. We see this one the most. A scammer gets your Medicare number, falsifies services and billing documents, and sends to Medicare. Once paid, you may be denied of future services when your real doctor orders it. So this is the number one that we see. We get a doctor's office that will call us saying that they're trying to get their client home health care coverage, but they find out their client has had home health care coverage for years, and it turns out the doctor never ordered it. Well, the client never looked at the Medicare summary notices, so they didn't know they were getting something. And this is a problem. Sometimes Medicare does deny these. Something else to watch out for when an agency bills for items other than what you got. A home health care agency calls or visits your home to offer free services like checking your blood pressure, cleaning your home, buying groceries, and a representative may even come to your home a few times, but there's more. And that's when my screen locks up. Come on.
Yeah.
Okay. Come on. You got to love technology, everybody.
Yeah. Yeah. Sweet talk
Come
it.
on. I'm trying, but I'm being recorded, so I don't want to sweet talk too much. Okay. So on Windows, Medicare doesn't pay for anything like that. And the biggest thing to know is that Medicare, they will pay for, now it's too happy. Sorry, guys. Let me try to get it to work. I think it's because our weather's getting pretty nasty here. Okay, so with the home health care, okay, there we go. All right, but wait, there's more. Your doctor never ordered these services. They are not any legitimate home health care coverage, and you're not homebound. I had a speech one time I did in Austin, Texas. I cover the whole state of Texas. And I was at a wonderful assisted living facility. And one of these ladies was very active. You know, she was only there, you know, every now and again. She would go in and out. She'd go to Walmart. She'd go to all these places. And she told me she couldn't stay for my presentation because she had to meet her provider. And I asked her, what was she seeing a provider for? She said, well, she came and did her toes. Well, it turns out the lady was getting home health care services and didn't know it. She just thought this nice lady would bring her an ocean water slushy from Sonic and do her toenails once a week. She just thought it was a friend of hers. Turns out they were billing Medicare for diabetic care, wound care, and home health care services. And it broke her heart because she really thought it was a friend, but it wasn't. To get paid for these services, the home health care agency turns in lies to Medicare. They will fake documents, and they will act like you really need the service and you don't. Now, we also see a lot of issues with prescription drugs in home health and hospice. And what we've seen mostly is healthcare providers and staff people will not give the proper medications to these folks. Basically, a staff person will throw away the patient's medication. They'll sell it or take it for personal use. Hospice, I'm going to go over just a very few of what we see here in our state. We've seen early or false diagnosis of hospice. And hospice is when your doctor has determined that you have 6 months or less to live. And a lot of people don't like talking about hospice, but Medicare covers hospice at 100%. And scammers know this. And everyone on Medicare has earned this coverage because you worked hard to get Medicare. You paid into your quarters or your spouse did. And it's very important that you do get end-of-life services, and your family should not have to worry about the bills. But unfortunately, scammers know that Medicare will pay 100% of hospice. So, of course, they get patients and their families involved in this fraud scheme. And they'll basically tell them to fake like they're dying. They'll give them money. Whatever money they get from Medicare, they'll give them a cut of it, maybe 10%. Something else we see is door-to-door solicitations by fake religious entities. Basically, they'll come to your door convincing you that there's a new hospice, more spiritual, and it's adult daycare, homemaker, or housekeeping services. They just need your Medicare number, and they'll go charge Medicare. Now, a lot of people say, well, how do they get this all to Medicare? Well, to commit Medicare fraud, you need a Medicare number and a doctor's signature and false claims. And for the doctor's signature, they force it, steal it. Even doctors are victims. Even their signatures are victims, unfortunately. Now, Medicare's prescription drug program and Medicare Advantage plans. From October 15th through December 7th, that is when you can enroll in a brand new Medicare prescription drug program or a Medicare Advantage plan. We see a lot of scams and frauds around this time, and it's very disheartening because, unfortunately, some agents take advantage of this, like sales reps take advantage of this time to fraud people. So I want to tell you what to look out for, and also know that there's help if you are put in a wrong plan. We can help you. All right, this is the scams we see during Medicare Part D and Advantage enrollment. You get a phone call, and it's basically somebody pretending to meet Medicare, and they can't do that. And they'll say something like this: "Hi, this is Jennifer from Plan XXX with Medicare. Do you need a new Medicare Part D plan? Wonderful, we can give you one. It covers all your prescriptions. You don't pay anything monthly. It's just $299 up front. You never pay again." Yeah, right. That's definitely a scam. Another one. "Hi, this is Jennifer from Medicare. You didn't spend all your money last year, and I need your bank account information so I can send you a refund from your last year's drug plan." Fake. Don't give them your don't give them your bank account. Whatever you do, don't give them your bank account. And the last one is an agent tries to sign you up for a plan that you don't need, isn't right for you, or doesn't exist. If you ever do meet with an Advantage agent or a Medicare Part D sales agent, never give your Medicare number until you are ready to enroll. Now, watch out for fake RX discount cards. Now, let me tell you about this. Jennifer Salazar, I have a Walgreens, a CVS, and a Kroger card, okay? I know that they are real. I went and I checked them out. But if you hear of a card that you've never heard of from an organization you never heard of, check them out just to make sure they're legitimate. You can always call me. I can look it up. I work for Texas Senior Medicare Patrol and the Better Business Bureau. I can find out if that card is real or not. Also, watch out for offers on big new healthcare plans with big discounts. Usually those are scams. And watch out for insurance agents violating the rules. That's right. Anybody that works with Medicare, like selling Medicare supplemental plans or Medicare Advantage plans or Medicare Part D plans, they have to follow a set of rules, okay? No healthcare plan, like Medicare, no plan can call you. They cannot cold call you unless you're a member of that plan or you ask them to call you, like if you went to the internet and asked for a quote. But other than that, by law, they cannot call you. Also, they cannot ask for your Medicare number, your Social Security number, and or your bank account information just to provide you information. For example, if you decide that you want to meet with a plan to go over plans, don't give them that information. Someone can use this information to enroll you in a plan without your permission. Plans cannot request this personal information at an educational event and cannot call you to ask for a payment over the phone. So if you do enroll with a plan, you don't pay for it online, you don't pay for it over the phone. You actually have it deducted from your Medicare Part B, or you send them a check. Next, they cannot pressure you. They cannot say you only have 6 weeks, you only have 5 weeks. They cannot do that. You can use the entire open enrollment period from October 15th through December 7th to make a good decision, They cannot say they represent Medicare. They cannot do that. That's a huge violation. I got a bunch of them last year for doing that. Plans are never allowed to suggest they represent Medicare, are preferred by Medicare, or any other governmental agencies. People who say they represent Medicare may also be identity thefts. Now, I have, in the state of Texas, we have 192 volunteers with the Senior Medicare Patrol. I have to deny any Medicare agents like that sells Medicare insurance into my program. I get at least 50 of them a year want to be one of my volunteers. They can't volunteer for my program because they can try to commit this kind of fraud. They cannot volunteer with my program. Also, watch out if they're trying to give you gifts worth more than $15. And they have to give everyone a gift. If they come and do a presentation and you're not a member of their plan and you don't want to be a member of your plan, they have to give you a present anyway. If they're giving people in the audience a present, they have to have one for everyone. If they don't have enough, they can't give them out because that is a huge violation. And it cannot be worth more than $15. And they cannot threaten you with the loss of your Medicare benefits unless you sign up for their plan. A lot of these plans may say, well, if you don't enroll with us, you're going to lose your Medicare. That is a lie. That is a scare tactic. They cannot do that. This is a copy of last year's rules, and I went over most of these, but every year, anybody that is an agent or broker of Medicare Part D and Medicare Advantage plans gets a set of the rules. In fact, they have to take training. I teach one of those sometimes for some of the Houston area agents. You have to know the rules. You cannot break the rules. All right. So I gave you guys a lot of scary information, but let's learn how to protect. I did. I'm sorry. I'm always the bearer of bad news. But you know what? I'm going to tell you how to protect yourself. I'm going to tell you how to combat Medicare fraud, error, and abuse with 3 simple words: protect, detect, and report. Okay? 3 easy things to remember: protect, detect, report. So first off, let's go over protect. I want you to do the following. Treat your Medicare card like a credit card, because again, it's worth more than a credit card. An average Medicare number is worth at least $30,000. Don't give that number out. Treat it like a credit card. No, Medicare won't call or visit you to sell you anything, ever. Be cautious of offers for free medical service. Like my mother always used to tell me, nothing in life is free but your mama's loving. There's no such thing as free. Somebody's going to end up paying for something at the end of the day. Watch out for identity theft. How do you do this? Watch your mail. Make sure that you're not getting credit card offers that you didn't apply for. Make sure that there's not weird things on your credit card or your banking account information, and watch your Medicare summary notices. I want you to pass this information on to your friends and family. I don't want you to do the following. Give out your Medicare number except to your doctor or provider. And a lot of people get mad at me for this one. Don't carry your Medicare card with you in your wallet or your purse. Why? Because on our hotline, the Texas Senior Medicare Patrol hotline, we get at least 5 people a week that lost their purse or somebody stole a wallet, okay? Only take your Medicare number if you're going to the doctor or you need it. Now, I had one lady say, well, what if I'm in a car wreck? Well, guess what? Medicare can be billed later. They can bill Medicare later, okay? Or somebody can go get your wallet. Don't carry your Medicare card with you, because if it ends up in the wrong hands, scammers know what to do with it. And if they don't, they know how to sell it, because they can sell it to other people. I want you to be a detective. I want you to detect. I want you to review your Medicare summary notices and other statements. I want you to watch out for services you didn't receive. So if you see like 6 back braces on there and you never got one, that's when you call me. I want you to watch out for double billing and services not ordered by your doctor. And I'm sorry, our little girl over here is covering doctor. Sorry about that. I want you, if you don't want to wait for your Medicare summary notice to come to you in the mail, you can now get that information online any time of day at www.mymedicare.gov. And also, our grant provides this wonderful little thing over here. It's called a healthcare journal. And when you open up your journal, it looks a lot like a checkbook. You write when you go to the doctor, and then you write the date, and then you compare that to your Medicare summary notice. If you're interested in one of these, at the end of the presentation, I'll have my email address, and I can mail you one, okay? Taxpayers, you've already paid for it because it is a federal grant, so we would be happy to ship you any of this stuff. The last step is the hardest step, is reporting Medicare fraud. Now, on our hotline, only 3 people answer the phone. Myself, I work cases just like my staff, Robert Obregon, and Sue Resnick, and we are there to help you. You should call your provider if you suspect fraud, error, or abuse. Gather the information and documentation. If you're not comfortable talking to your provider, if you really feel it's possible fraud or abuse, call us. We're there to help you, and our number's on the screen. And we're going to send this presentation to Bethany so everybody will have it. But our toll-free number is 1-888-341-6187. And the call is confidential and free.